Yeah, so we audited our service about 2 or 3 years ago and found really significant gaps in the lipid service, in the way that we talk to the patient and manage the lipid lowering in the hyperacute stroke unit. And we didn't do very well at all. And so lots of patients were being discharged not on the right dosage of medications or not on any medication at all sometimes, and they're not being followed up properly. And we're not chasing the GPs or chasing the primary care to repeat their cholesterol, for example. So we we got one of the nurses to second into a post, which is the stroke lipid uh, specialist nurse post, the CNS post. And so what he did, or what he does, is to find the patients every morning um, with ischemic stroke or TIA, and then make sure all their bloods are done, and with the result to make sure that the statin prescription is according to guidance. And then the most important thing is educate the patient about the importance of lowering the lipids, lowering the cholesterol, and adopting a healthy lifestyle with improving the nutrition, exercise, as well as the blood pressure control and diabetic control and weight control. And then we see them in clinic 6 to 8 weeks later, and we retest the cholesterol using a finger blood test. So we get the result there and then, and we give a instant feedback to them about their cholesterol and how they can change their medication going forward. And if they satisfy the criteria for an injectable treatment, then we can put them in the clinic, and they then come back to my clinic for the injectables. So we've kind of started a service that gives them a seamless lipid lowering control from the moment they arrive to follow up and make sure that they get down to the treatment target of below 1.8, and that's when we're happy. So what we know is, since we started the pilot with the specialist nurse, before it was below 50% of people were hitting the target, and now it's almost 3/4 of people are hitting the target. So we know we're doing well. And with the injectable clinic as well, I would say 80-90% of people will be within target, um, which means reduced risk of another stroke or heart attack. So yeah, it works.